joint, anterior view. You can see lower end of the femur, you can see the tibia, and then you can see laterally is the fibula, and you can see even the tibial tuberosity. So what you're going to see in this knee joint is the first thing is this large tendon, or you can say it's a ligament. That is a sign that there is a muscle that has its combined tendon, which is the quadriceps femoris, which becomes the ligamentum patella. So this is the ligamentum patella, and it's completely inserting over the patella, and then it's going to the tibial tuberosity. This is a ligamentum patella. All right. If we see over here, is this the medial or lateral side? It is the lateral side, because you can see the fibula here. So this is the fibular collateral ligament, or known as the lateral collateral ligament. All right. And going on the medial side, what can you see here? This is the tibial collateral ligament, which is running from the medial side of the femur, femoral condyle, and going all the way, inserting on the medial surface of the tibia. So this is the tibial collateral ligament. Okay, what can you see within the cavity of this knee joint? These two fibrocartilaginous rims, these are known as the menisci. This is the medial meniscus, because this is the medial side, and this is the lateral meniscus. All right, that makes sense. And you can see that there are multiple ligaments that are inserting in the intercondylar area of the tibia, and we've talked about what they are, the horns, and then the cruciate ligaments. Let's go behind and look. You can see there's this ligament that's running from the meniscus all the way to the femoral condyle. So this is known as the meniscofemoral ligament, whereas this ligament right here is the posterior cruciate ligament. It has to go from the back and goes ahead to get inserted in the medial condyle of your femur anteriorly. And anterior cruciate ligament is visible over here. It begins from the anterior part and goes behind. All right. So the most important part is the fact that the lateral meniscus and the fibular collateral ligament actually are separated from each other by the tendon of popliteus, which is not visible here, but otherwise these two are separated from each other. Whereas on this side, the tibial collateral and medial meniscus are actually linked to each other. There is a connection between them. So if there's any injury to the tibial collateral, there is usually a injury to the meniscus as well. So that is clinical significance. And apart from that, that's all for your knee joint. What you can see here is the hip joint and the ligaments associated with the hip joint. So we have three main ligaments connecting your various parts of the hip bone to the femur. You know that the ilium bone is connected to the femur, and the ligament that lies anteriorly, this is the iliofemoral ligament. It is also known as inverted Y-shaped ligament of Bigelow. Alright, so this is the iliofemoral ligament. The one you can see attached a little below, coming from this medial bone known as the pubis, all the way to the femur, this is the pubofemoral ligament. And posteriorly, the entire area is occupied by the ligament that runs from your ischium bone all the way to your femur, the ischiofemoral ligament. So that was all for the ligaments of the hip joint.